This is the Naples Daily News, and we have Dan Butner here, founder of the Blue Zones Project, and Debbie Millsap, Executive Director of the Blue Zones Project in Southwest Florida. And we'd like to talk to you a little bit about how did Naples get selected for a Blue Zones Project, and how did you connect with the NCH healthcare system?
They didn't really get selected. Alan Weiss, the CEO of NCH, actually did a search, and they're one of the few healthcare systems in America, I think, that are really sort of taking this accountability idea to heart and trying to generate health rather than just making sick people less sick. So he was out looking for projects that have been successful at the population level at making people healthier, and he found us, and he actually came to see us in Iowa, and then we came here to make sure people really want us to be here, the schools, the grocery stores, the city government, and we kind of chose each other, actually.
Okay. And do you have any other healthcare systems that are sponsoring Blue Zones initiatives elsewhere in the United States?
Yes, in Los Angeles, there's a healthcare system sponsoring it. It's mostly the Blue Cross Blue Shield plans, insurance companies that want to see insurance costs or healthcare costs go down over time. But I would say NCH is way ahead of the pack when it comes to really thinking about avoiding disease rather than treating disease.
Okay. And Florida is the first, Naples is the first location here in Florida that is pursuing it, is that correct?
Yes.
Do you find that unusual?
This is a new idea, actually. I would have expected to see it really embraced in places like San Francisco and New York, where there are big populations. So there is, I think they're batting beyond their league when it comes to innovation. I know Florida hospital systems had looked at doing something with Blue Zones a few years back. So I think with an aging population and so many people coming here later in life, I think there's a natural appetite for this sort of thing.
And does that pose an issue that we are a seasonal population with winter residents who are older, and then we have tourists who don't live here and are part-time residents? Does that pose challenges that are going to be difficult for us to address?
No, it doesn't matter. The Blue Zones, unlike other sort of preventative health programs, instead of trying to change individual behaviors, we try to change the environment, the places we live in, our homes, policy at the governmental level, schools and restaurants and so forth. So it doesn't matter when people come or who it is, it doesn't matter their ethnicity or their demographic breakdown. This is one of those things that's going to lift the tide that rises all boats.
Okay. Deb, what do you have to say about it? I mean, how is our local project addressing the retiree population and the part-time residents in our plan?
Yeah, it's really a we project. So we want everyone to embrace it and give everyone the opportunity to embrace it. And so our kickoff was some of our events have actually been scheduled for when our seasonal population is back. And so we've been working hard on it. We're now launching it, and so we're looking forward to our seasonal residents being involved. We really look at that as an enhancement too, because as they go up north or out west, wherever they come from in the summer months, they'll share it with other people. So it expands beyond.
We've had a little bit of a pushback locally from the school district. We have some parents and some school board members who say we don't want this. Has that happened in other locations or with other government entities, and how do you address that? It's
never happened. This is the first time, because we spent time to get to know this community and make sure we were wanted, and the superintendent indicated that this is something that Naples was interested in. And then we came down, and some board members had a problem with it, but they had a problem because I think they failed to understand what the program is. All we do is come with a menu of evidence-based ways to make a community healthier, and the schools get to choose which ones they want to implement. They don't have to implement any one of them. But if schools want to have soda machines and they think that's the best thing for their kids, they can have them. But then we'll have 3 or 4 other things we want them to do to make fruits and vegetables more accessible and sweets a little bit less accessible.
Okay. Are there any other communities in Florida that are kind of watching what's happening here in Southwest Florida to model after us or to make a decision about going forward?
You know, as Dr. Weiss talks throughout Florida, and he's with the Florida Hospital Association. He also talks nationally, and he gets a lot of interest because of what he's doing with the Blue Zones project. So I wouldn't be surprised if there's some additional communities that.
So we're in 26 cities throughout the country, and we find what happens is you start with one city, because every state is a little bit different, and the project shows up slightly different depending on where we are. And we're very rigorous about measuring. Healthway's Gallup Wellbeing Index will measure 90 different facets of health, well-being of the population here. And I think we have to earn our way into a state. We have to show that we can make a population healthier, and then it's a lot easier to spread statewide. We started with 3 cities in Iowa 4 years ago, and now there are 15 cities in Iowa. So it's the demonstration site model.
Absolutely, interesting. And so economically, what will the impact be for us locally? Will it be an economic boost for us ultimately in some way?
I can give you some examples of other places. So in the beach cities, 150,000 people or so, we managed to lower the average BMI by 14% and cut childhood obesity in half, from 18 to 9% in 4 years.
And that was 4 years? Okay.
4 years. It takes a while.
Yeah.
You don't see it overnight.
Sure.
But that will occasion literally tens of millions of projected healthcare savings. We also lowered the smoking rate by 29%. So that means in 10 years there won't be a percentage of lung cancer. There are 1,900 fewer obese people, so they're less likely to suffer type 2 diabetes, heart disease, and cancer. So the actuaries have modeled out what that will save them, and it's in the tens of millions of dollars. And we expect to have an even bigger impact here.
And so funding-wise, we know that NCH is funding the program, at least initially. How will this program sustain itself through the years to come, for 8 to 10 years out?
I actually don't know the specifics of.
Well, one of the things from the get-go, with it being this WE project, and primarily the volunteers are the ones who come in and make it happen, NCH invested for 8 years so that we could really lay the groundwork and get as many people on board, have that kind of tipping point where people are sharing with each other to keep it going. So that's part of the plan. It's just this long commitment to the project. And then through the Blue Zones project, there is monitoring to keep you certified after you become a Blue Zone certified area, so community. So
I can tell you economically, nationwide in our 26 cities, have found about $150 million of grants based on Blue Zones work, optimizing the built environment, optimizing the food environment for schools. Blue Zones becomes a platform then to attract economic support for doing the work of health. And I think the big advantage is we actually measure. It's not one of these things that it's a feel-good veggie, eat your veggies, or fun run. We actually are measured at the beginning, and every year we're expected to return lower BMI, lower weight, lower smoking rates, increase in healthy behavior, and then a rise in overall well-being. And that occasions more productivity system-wide, lower absenteeism, and all of these have a connection to overall economic well-being.
So at some point you'll do a measurement, a benchmark measurement for this region?
it's already been done.
So that's been done, okay.
Yes.
So when was that done?
That was done in the spring, this past
Okay.
spring.
Okay.
And then as we work in the community, we'll remeasure with the Gallup Healthways polling, and remeasure and see how we're doing, tweak if we need to. But it's definitely based on measurement. You know, we can't manage it if we don't measure it. And there's lots of other measures too. You know, a grocery store is going to have different measures, and a school is going to have different measures. So there's.
I remember reading, and I can't remember which communities it was, about parks along a riverfront or greenways along a riverfront. How much has Blue Zones fostered projects that may not have happened in some communities?
So the first step is to realize that part of the obesity problem in America is because we're sitting in our cars and not on our feet. So, and that part of the reason is because it's so much easier to drive than it is to walk. We have an expert on our team named Dan Burden, who begins by taking city leaders on a walk through their neighborhood to see why it's hard or dangerous to walk. And then he creates a vision for a more walkable community, like Riverside or a Main Street. And once they can see a vision of it, and once they can understand how that will impact obesity numbers, then it's a lot easier to change plans so that streets are built not just for cars but also for humans.
But that takes money to do that. So do you have to get the government's buy-in usually, or?
It actually doesn't. It can take money, but there's money allocated. So every 3 or 4 years, roads are redone. So the next time roads can be redone, you can add a lane for traffic, or you can add a lane for bicyclists and widen sidewalks. And it's really up to the community to decide. We're very good at working within existing transportation budgets and not trying to go out and spend new money.
Okay. But this is not, I mean, we're not an urban setting here. We are very dependent on our cars in Southwest Florida. You've seen some of these roads. So based on your prior trips here, do you see it's feasible that we can get bike paths along some of our major corridors?
Yeah, this is a example of function following form. Cities are going to continue to sprawl. You do have some, if you let them. So you have some really nice community centers in Naples. I've been downtown there. There's a wonderful, that could be nurtured, or that could be, you could create economic forces that make that dissolve. So what we're going to be doing is try to plan, find those sort of natural centers and foster them to be more human friendly, so that more people are getting out of their cars and onto their feet.
So looking forward, 8 years from now, 10 years from now, how can you see Naples being influenced, changed by the Blue Zones project?
Well, I think there'll be, just guessing, I would say 50% of the schools will be Blue Zone certified, so it's a healthier environment for kids, and you're going to see BMI drop in kids. I think we'll see 100 or so Blue Zones approved restaurants where the healthier choice is a little bit easier, and people are eating healthy every time they go out to eat in those restaurants. I think we'll have the big employers here making their workplaces a little bit healthier. I think there'll be a half a dozen policies passed that are going to favor fruits and vegetables over junk food. It's not going to be a single silver bullet, but what we're good at is unleashing silver buckshot. Each of those little BBs move a population 0.5%, and we'll unleash 40 or 50 of them. And measuring it every year, we see every single time there's an improvement. So just guessing, there'll be a 10% improvement in this community. Lower BMI, lower smoking, more physical activity.
Sounds great. Thank you. Appreciate it.
It's great being here. Thank you.
Thank you.